This is a very common question in your exam. We have a patient, 11 years old, boy, has sore throat, fever 38.1 Celsius, no cervical lymphadenopathy, tonsillar erythema, and your options is to give antibiotic or to do rapid antigen test or supportive treatment as fluid, antibiotic, and so on. The problem with this scenario is to understand that this pharyngitis or tonsillitis could be due to viral infection, which will not need any antibiotic, or could be bacterial like streptococcus antigen, which will require antibiotic. To answer this question, you have to memorize CENTOR criteria. We give for each one of this 1 point or subtract 1 point, then we will collect this point. Let's go through the criteria. If the patient has fever, especially more than 38.3 Celsius, you will give 1 point. If there is no viral symptoms as conjunctivitis, rhinorrhea, or cough, you will give another point. Please, here, no symptoms. If he has any one of these symptoms, you will not give anything. Tender cervical lymphadenopathy, you will give another 1 point. Tonsillar erythema or edema, you will give another 1 point. Even if they mention abscess, something like this, you will give direct antibiotic. What about the age? If the patient between 3 to 14 years, this is common age for Streptococcus pyogen, so we will give point. If between 15 and 44, you will not give anything. If the patient greater than 45 years, you will subtract 1 point. So let's go back to our question and count how many points. In this question, the boy is 11, so we will give him 1 point for his age. His age is here. The patient has sore throat, okay. Fever is 38.1, so no point for the fever as it is below than 38.3. No cervical lymphadenopathy, so no other point. Tonsillar erythema, this we will give point. So if we count this point here, of course they didn't mention that the patient has any conjunctivitis or cough or something like this. So the point here will be 2. What 2 mean? Let's check. Here 2 means that there is a chance that the patient have bacterial infection around 17%, around from 11 to 17, which will require to do rapid antigen test for detecting this bacteria. If 0 or 1, if the calculation was 0 or 1, you will only support treatment, no test, no treatment. If it is 3 or 3, you have 2 options to do test, which is rapid antigen test, or to treat empirically. What about if the patient if the patient point more than or equal 4, you will start directly with antibiotic, empirical antibiotic. Also, there is some recommendation. If you have the test, you can do it. But in the exam, they will not bring both of this option together. That's all what you need to know about CENTOR criteria. You have to remember this. You have to remember 0 and 1, nothing to do. 2 is rapid antigen test. 3, rapid antigen test or treat. 4, treat. Thank you.